So thank you, Dakshinamurthy, and I am happy to be here. So I want to talk about why I am doing all this. So I am here only because my grandfather was born in 1900, and his name also happens to be Subramaniya Nataraja Pillai, and this happens to be the place is gifted by us by Subramaniya Samaj. Subramaniya is actually the name of Lord Muruga. And I don't know whether any of you know, in Tamil Nadu, we keep everybody's name a God's name. The reason is so that you cannot scold him. So my great-grandfather was Subramaniam, and my grandfather is Natarajan, and he was an eye doctor. He became a licentiate in ophthalmology and licentiate in LMP, licentiate medical practitioner, in the British time in 1920 itself. And 1930 he was in government eye hospital, where I was also there. But my father, Dr. Sundaram, he was born in 1927 in Kulasegarapatnam. Anybody knows, Avik, you worked in Arvind, Madurai. Do you know where is Kulasegarapatnam? Okay, Dakshina, you know? Now what is the importance of Kulasegarapatnam today? When my father was born, it was not important, only for the local people. Do you know? It's going to be an international center like Sriharikota. That's going to be the ISRO's next bigger launching pad of a rocket, because the location is like that. It's a beautiful seashore, and there's the Muthumaraman temple. Avik should know, they celebrate the Kali Puja 10 days Dashara better than Bengal, and only in that town. And and everybody dresses up like Kali.
That's nice to know, sir.
No, not only that. They get into, in the south, they actually think God has come. I don't know what it is, but anyway, Ramakrishna Paramahamsa also had that. Ramana Maharishi had that. And somebody has written, I forgot the name, Arun Shauri. He's written, they were all in trance and nothing to do with God. But actually it's God, according to me, because Swami Vivekananda also told Ramakrishna, show me Kali. He said, how can I show you Kali? You want to see Kali? You see. So I am waiting for that moment to be with Kali, and I think it will happen. So these 3 generations. You can see he was a smart with a strict mustache, and I am telling strict because he is very strict. He used to clench his teeth, and you can hear it outside. And I was always afraid to meet him. And he used to, and this was his biography. He passed away in 1977. He studied in St. John's College in Tirunelveli, Palayamkottai actually, and he graduated from Tanjore, and he also worked in the various places, and then he has made, what is this? This is not... So my father was, as I said, born in Kulasegarapatnam. So he always had a success. He mentioned this, and success comes from hard, devoted and dedicated work. And my father was telling about my grandfather that he worked from Kanyakumari to Orissa that time. It's Madras Presidency. He worked in Ganjam district. He worked in Andhra. He worked in Tirunelveli, Madurai and Tanjore, everywhere. And later, in 1941, he went to Government Medical College and Government Erskine Hospital in Madurai, and where Dr. Venkateswamy was his junior. What, Avik? Dr. Venkateswamy was junior to my grandfather. My father was junior to him. My father also worked in, because of the government service, a tutor in biochemistry in Madurai Medical College, when Dr. Venkateswamy was assistant professor of ophthalmology in Madurai. So he was born in January 1927. And he retired as the head of the government ophthalmic hospital, where myself, like my grandfather, lived in 1930s to 40, and my father came in 1955 there, and I was born in government Erskine Hospital. Now it's called Government Rajaji Hospital in Madurai, and then I lived in that compound from 1957 to 1969, and then he was a superintendent, and he has started the various clinics. The main thing he started was the genetic clinic in 1984. He started special clinic on genetics, which was the first of its kind, maybe in India itself, and under government of Tamil Nadu. He performed about 30,000 cataract surgeries and organized more than 1 million surgeries as a chief of the camp, and done refraction for 3 million people. So because he used to ask me so many questions, I hated doing refraction, so I stopped doing refraction. And so he has conducted more than 100 eye camps during his service, and then he worked under the banner of various NGO with Lions Club, Sai Trust, Kanchi Trust, and also he made his own trust. And he was very fond of educating public, so he made an eye exhibition, and this is there in the Science Center in Chennai, which is called the Periyar Science Center in Adayar. And there's a thing called NS Sundaram Eye Corner. I wish I can do that in the Science Center in Mumbai. One day I will do it. So he is fond of doing exhibitions, and he used to make me work on that, and he has done for the last 50 years that time. Now we have to start that again. And he also authored many books on cataract, glaucoma, diabetes, vision and eyeglasses, genetics, children's eyes, red eye, head eye. He actually got it published in Tamil and released by Dr. Venkateswamy, and the founder of Arvind Eye Hospital. And the last Tamil book he wrote was Kanvoli, which was released by Shivanandan in Shanmukhapriya Hall in Mumbai. And then he also wrote a book, Kan Padhukapu, in 1981, a chapter introduced in the 7th standard textbook, because he was very particular that everybody should know what is eye. And his special interest is community ophthalmology. So the whole center is named after my mother and him. So I'm happy I could dedicate this. But the Community Ophthalmology Center here, I inaugurated on January 19th as Dr. S.S. Badrinath International Institute of Public Health Ophthalmology, and that's our dream. So this is the one which recently Elton mentioned. Vision is our mission, and I think my father mentioned in 1980s, and he was a recipient of Seva Ratna Award, Vaidya Ratna Award, Lifetime Achievement Award by Tamil Nadu Ophthalmic Ophthalmology, and then also the Dr. G. Venkateswamy Award for Community Ophthalmology in Tamil Nadu. And lastly, he served as the rector of Aditya Jyot Institute of Optometry and mentor of Aditya Jyot Foundation for Twinkling Little Eyes. The place, you can see the Minister Eknath Gaikwad and his daughter MLA, what Gaikwad? MLA का नाम क्या है? एकनाथ गैकवाड़ का डॉटर का नाम क्या है? Madam? She is in Sion, madam. Sion Dharavi. What's her name? I forget her name now. I forgot her name. That's the daughter. She is a MLA now. Varsha Gaikwad. So this is the Mr. Chelladurai. So that's me, and my father is sitting there. He always insisted that I should go and give a talk to school children. I used to get bored, and I used to fight with him. What is the point in going and talking on diabetic retinopathy to them? I realized later, then I started giving a lot of school lectures. He told me, let them understand whatever little they know. Only thing they have to know is if their father or grandfather or great-grandfather has diabetes, they should take them to eye doctor. That's all they have to know. But for that, give a lecture, he will tell. So this is next to Sion Hospital, madam. There is a school there, and which even now I go, and that's our center, which is there in Dharavi. That fellow is Chelladurai. It's called Gandhi Education Trust. That we are having that as our registered address. And that's my father and mother and 52nd wedding anniversary. So that was my rental house in 2007 when, because my mother developed paralysis of both sides, and I decided to bring her to Mumbai. So I daily made her go out in wheelchair. I had 5 people, thanks to Mahadev. Mahadev is here today? Pradeep? And can you call Mahadev or Sandeep? Can you call Joseph and Mahadev? So my Mahadev used to carry my mother and take her to the Five Garden daily. And also all my installation as a president of Bombay Ophthalmology Association, Maharashtra Ophthalmic Association, she was there. And I could not take her out, but in Mumbai we had a special car my father bought. So we should take her in the, it's like Tata Omni, I think. So now this is what I learned from my father. Eyes that heal, hearts that serve, deeper purpose of eye care. And I am very glad Avik has imbibed that from Arvind Hospital. He mentioned in his talk. I will replay his talk in the YouTube and see. And everybody should, young eye doctors should download his talk and probably my talk to just to tell the young people that we are grateful to our teachers for whatever we are. He is grateful to Dr. Naresh Babu, his teacher. I met him last week in Shankaranatralaya. So coming to the today's topic, the main thing I want, as I said, I am dedicating to my everything to my father, mother, and Joseph. I showed my mother's picture. I wanted to thank you because Joseph looked after my father and mother continuously, and last few months, I think probably some circulation problem in the brain. So my father was irritable, so he was all the time fighting with me. So interpreter was Joseph, and he was complaining about me to him all the time. And last 4 months he lived in Chennai and died at the age of 89. No, I thanked you and Mahadev because we had 5 people carrying her daily and taking her out. So this is my oration which I gave in Vitreoretinal Society of India. I am a founder of Vitreoretinal Society of India along with Dr. Dr. Ursekar, Dr. Rumi Jahangir, and my membership number is N003. So this is Dr. Patnaik, and that is his wife Kalsi, and you can see Dr. Patnaik, Dr. K.K. Mehta, Dr. Dean Elliott, Dr. Badrinath, because I was doing this International Advanced Vitreoretinal Surgery course. This was in 1999, and you can see my fellows and faculty, and you can see Dr. Rajat Agrawal, Dr. Dinesh Talwar, Cyrus Shroff, and many. And like Joseph, there is Sanjay there. I cannot forget him. He was my, and he is the chief of RP Center, Dr. Atul Kumar, Dr. Sunil Parekh is here. He was a versatile surgeon. And I think the reason is we are teaching from the year 90 and from 1984, because I started doing vitreoretinal surgery from 1984. And this girl Gayatri she's an optometrist, and she's married a guy who was supplying intraocular lens to us, and now she's divorced. And she's in Chennai. And then you can see Dr. Daljit Singh. He was my fan. And to my left is Dr. So anybody knows? Avik, you know who's to my left?
SS Hare.
Correct. Sohan Singh Hare, the authority on optic nerve. And Daljit Singh was my fan. He used to come to my OT and teach me, not teach me, to give me ideas how to remove foreign body. He was a cataract surgeon. I assisted him in 1982 for his intraocular lens as a postgraduate. And I decided to go to Amritsar to learn. That time nobody was doing intraocular lens, including K.K. Mehta. And I was a postgraduate, and now in Government Ophthalmology Hospital, even doing a cataract surgery was a problem. But I still did 500 cataract surgery as a intracapsular cataract surgery as a postgraduate. And I thought I should learn steel sutures and an iris claw lens from him. And unfortunately, Operation Blue Star happened, and I could not go to Amritsar. Then I joined Dr. Badrinath, and that's Dr. Patnaik there. And Dr. Indu Singh, she did the first meeting in Amritsar for a Vitreoretinal Society. Then we started every Saturday during the Vitreoretinal Society. We have DJ and make every vitreoretinal surgeon dance. The reason is, unless you have a strong back and a strong front, you cannot be a good vitreoretinal surgeon. Otherwise, you will have back pain. And 55% of back surgeons have. So this is the agreement of annexure to VRSA, where we made a contract between how VRSA conferences should be done. And now I'm happy Joseph has made the SOP for a conference. So my passion is vitreoretinal surgery. I actually took up this idea of one idea, make that one idea. That's my Swami Vivekananda, which I carry all the time. So he says, take up one idea, make that one idea your life. So my idea is ophthalmology. Think of it, dream of it, live on that idea. From ophthalmology, it became vitreous and retina, and let the brain, muscles, nerves, every part of your body be full of that idea, and just leave every other idea alone. And for this, my CEO wrote, you are thinking every minute, but your staff cannot cope up, so you stop sending messages after 5 p.m. So I have agreed. This is the way to success, and this is the way great spiritual giants are produced, and others are mere talking machines. and I know I'm working with talking machines. And VR surgery has been passion because of Dr. Badrinath. I never wanted to be a VR surgeon. I actually wanted to learn microsurgery, and nobody was teaching me. And we had a microscope in ophthalmic hospital. As you know, I'm publicly telling, even now it's happening in Europe. The teachers will not give to the juniors the new machines. And here, the Bausch machine, I didn't operate still in Mumbai, but Avik has operated. And that's what Dr. Badrinath did. Whatever new instruments he brought, I did the first endo laser in India, thanks to him. He brought the machine, he brought the first curved scissors from DORC and all the instruments from DORC, and I did the relaxing retinectomy first and not him. And that's the greatness of the teacher, because his teacher was Charles Capens, who also trained Dr. Namparamal Swami. So I think all the great teachers want their students to be greater than us. So I wish now Avik to excel us. So this was the lecture given a decade back. That means now 4 decades have gone. So I have that time performed more than 27,000. That was considered vitrectomy and combined. But now I separated and made it 65,000 vitreoretinal surgeries. And I am a proponent of scleral buckling surgery, which I still do, and I also do complicated trauma cases, and that's how I went to serve the humanity in pellet injuries in Kashmir. So the scleral surgery everybody knows, and I call it the fine art of scleral buckling, and we also how we do the drainage, and you can see how the retina is having detachment and how the retina is attached with a good vision. Even if the macula is off, we can do that. And other philosophy which I am popularizing, in 1984, Michael Belkin said, nobody should remove the eye after an injury, even if there is no perception of light, for the fear of sympathetic ophthalmia. And I am propagating that. I am sad to see it happens even in Mumbai, even now. In case I come to know, I stop it and make sure that the patient comes to us and we do the repair, even if there is no light. It's only it's the only thing in ophthalmology where you can operate when there is a trauma, not in any other condition. So this evisceration enucleation I strongly condemn for unless there is infection like panophthalmitis. So we have to preserve the eye and make sure you preserve the globe and get the best for the vision. So I follow Ferenc Kuhn, who visited this center. The trauma center is named after him, Ferenc Kuhn Ophthalmic Trauma Center here, and he was there in Sion Hospital also. And he's taught us the strategic thinking and have an individualized approach. Think again and again what's the most suitable line for a given patient. So we have to have a systematic approach and cannot have just like that trial and error. And that's what Ferenc Kuhn said, and he's published this in 2002. And timing of vitrectomy we should do as early as possible, and that's what we have learned. And these are the videos are not there. So, and we introduced the first retinal endoscope in Asia, preferential hyperacuity perimeter, the first forehead domain optical. So I'm very proud to say that we introduced the OCT first in India, and then only the other Shankarnetrala and everybody, LV Prasad, Arvind got it. And photodynamic therapy, again I introduced first in India, sutureless surgery along with Dr. Mark Humayun, and BIOM, which is revolutionized by Dr. Mark Spitzness in 1987. Unfortunately, it was not popular in Germany too, even though the German company Oculus made it, but unfortunately it was not popular. I popularized from 1990, and now I remember till 95, the whole world was having resistance from moving from contact lens to non-contact BIOM. I don't know why, but I was happy because I wanted to buy something new. So when I took a loan, I bought the first BIOM in Aditya Jyota Hospital, and I made whole world come to see how it is. And we also did the twin light endo-elimination vitreoretinal surgery for doing the bimanual vitreous surgery, and injected also introduced Lucentis first and now Vabysmo also before its approval, and many things like that. And first Constellation, IOL Master, the BIOM you see here. This is the BIOM 3, but I have the BIOM 1, 2, 3, 4, 5, and now 6 is coming just now. And I also made a curved cutter which was published in 1998, which was made by DORC. I don't know why, unfortunately we could not make it because the problem was how in the curved thing the cutter will work, but it worked. And I'm happy. Somebody said you can bend it, and Steve Charles used to make fun. Why not you put this curved cutter in the Viagra solution, it will become erect, he said. And then this is the suction forceps I introduced. And then this is the OT table, because when Dr. Charles Keepens came to my OT in 19, he asked me, the patient is going to lie down in local anesthesia, and you can see there are 2 cushions in the table, because he said when you lie down for half an hour as an old man, I have back pain, what are you going to do for the old people? So I put a cushioned thing so that, Avik, this is what we have done. We have put extra cushion, we should put it here. Because the patient will have problem for, if I operate for 3-4 hours, no. So because Charles Keepens came and lie down, and then for neck also I made so that the neck doesn't pain for him. So that's why they move like this, and microsurgery, it's a headache. So these are all small things, but so this I call as Maharaja chair. This back curve, this is what I know you are not happy, but I want to say, Joyce. So everybody, where is the Joyce? Ravana. The whole world wants to see you. Come here, Joyce. And I hope camera mein dekh raha hai na? So Joyce is there with me from 1988, and she is the nurse who joined me in 1988 in Bombay Hospital. Every OT in Bombay, she was with me, and made everything right from screw to nut to everything she made. Thank you, and thanks for taking care of your grandson Avik. And so this chair, she knows I made the carpenter design, and now the Appasamy I made them do. And I hope the new chair, one more we have to get for us, so that I will use this. And I have designed a handrest where elbow weight will go to the back, and then the elbow weight will come near, and then only the lumbricals will work. So I think I posted last week in the Facebook what is the meaning of lumbrical muscle and how it will work. So I also made the first vertical Amsler garden. You can see Neil Bressler and Susan Bressler with Mr. Sushil Kumar Shinde, the power, he was the power minister that time, Minister for Power. And you can see behind me is Mr. Ravichandran, who is the CEO now for KamalaSundaramFoundation, and that time he was the CEO of Ayurveda Hospital. And then on this side is standing alone is my father. So everything is dedicated to the patient, and the Amstel garden is still there because I got this idea from Singapore, where now I'm happy the airport is copying. They have vertical garden, but they don't have the Amsler garden. But entire airport in Mumbai, everybody should see that. It's an art piece where T2 has this vertical garden in every place where you board the flight. And thanks to that time Chinmay, Nayan Ghosh, my fellow, Hitesh was there, and now Samir is doing everything for me. So Boshan Lam is telling me, from there I can see Dakshina is telling, we have given you money and you are not talking. So now I am talking. Again I am not talking Boshan Lam first, because I don't have I don't take the money. I don't have any financial interest. So why heads-up surgery is important? He mentioned about the patient, how can we do 40 surgeries a day? I think Arvind, they do 100 a week, cataract surgery. A single surgeon will do 100 a day? Or no? No. One surgeon, how many you will do in a day, maximum?
Cataracts are usually 50.
Okay, so he was telling that it will pain in the back, and then use the head-up, he is saying. I am sure Arvind will not agree for that, because 50, I don't know whether you can do it head-up, I am not sure. But the idea is head-up is important, because the main thing is everybody talks about, I think, because I think who introduced, I think RTO came with the head-up. Alcon came with the head-up, and actually it was True Vision from Japan. But main thing is Dr. Eckhart popularized it, and everybody said it is because boring to see through the binocular, and you have to see like this, and you cannot, no need to have no neck pain there. Now I remember one group of surgeons are complaining there is a neck pain looking to the right. Now Boshan Law must come out with it straight. But I think nevertheless, more important is to do exercise. All this ergonomic, I think, is not the which no company should talk, but I think probably they don't know how to do marketing. So I think the marketing it's amazing. It is like I feel I always imagined in my thing. Anybody is remembering that fiction movie where they put a what do you call that small micro video and swallow it and it will travel into the gut. Now it is available as a investigation, but it was a fiction once upon a time. So I like that. I want to make an eye model and sit on the macula and see the lens, see the iris, and then I'm happy Dr. Siddharthan made something like that. I have given this idea to, once I gave it to the Consul General of Japan to do it in Science Center in Mumbai, because they have optical illusion. Even in Tirunelveli, it is there. The Science Center has I came and gave a talk. So there are, I think, 25 science centers in India. I went and met this Minister for Museums are there. I went and met him. That time one pediatrician was there. Somehow, anyhow, I could not impress them. But one day I will do it. And I think probably the Ratan Tata Trust can do that, because I want to improve the eye museum in Madras and also the museum in Delhi, which I got it done when I was in. The Bausch & Lomb wants the regular microscope to go to the museum. Correct? So this is the first concern for a veterinary surgeon, to maintain a comfortable and stable position that allows to carry out the surgical procedure safely, which was published by my friend Romano in that time. And I think this was in the Eye Journal in 2018. It is always a thing. And I remember in the first time, I don't know whether you read the paper, most of the VR surgeons, when they are doing the ILM peeling, they don't blink. And they will have dry eye. And they will have stress. They will have watering. But I think I want to do a study to look into my eye. I blink normally and I keep talking to the world and do live surgery. So I think it's in the mind, and I suggest to read that book, Concise Mastery of Concise, what is that? Richard Green book, Concise Mastery. So you have to be a master in whatever you do, and he talks about neurons, mirror neurons which will develop. And this is what I talked about. I showed the chair, and I'm happy. The first thing which I used was Ingenuity 3D. I didn't buy, but I used it for demonstration. So we should give credit to them for that. The problem is they removed the eyepiece. So it was a headache. People who don't like, now RTO came with the head up, what is that, binocular and head up and 3D. And then they came out 3D and they removed the eyepiece, which is again a sudden change is a problem. So it has the high dynamic range camera, which is the best part of it. And high level of precision with the Ingenuity removes the need to focus without losing detail. These are all finer details which each surgeon has to learn to master. And I remember the True Vision guy came and told me, I'll give a lecture for a day, then only you can do this step and 5 minutes. I said, you keep giving lecture, but I will go and do like that. That's what I do for any new machine. I know you have to go through the manual, but for me everything is there, because I see the masters using it in the beginning itself. And this is a True Glow microscope made by Apasami. I think we have to give applause to them, because an Indian company making a 3D, and I think some surgeons in Chennai are using, and they have a complete 3D setup with a 3D digital recording, but still they can't match the best. It is like the Indian car and the Mercedes, and then in the Mercedes again the GLE and the GLS, and in the GLE also GLE 300, GLE 400, and I'm not talking about the money, but I'm talking the safety, the fantastic pickup, because that's the same thing we enjoy. But I enjoy speed, and I used to drive in the Autobahn in Germany with 250, and after a long time I did in my BMW Pune to Mumbai in just 2 hours, from Pune Marriott to Dadar. It's risky, but I think that was the first time the Mumbai-Pune highway was made. And then now I did it in recently with Ferenc Kuhn in 200 kilometers, and he was really worried. He said, my heart was in the mouth. My driver had a heart attack. He's admitted today. And I still don't have. I don't like the roller coaster. My son loves it, but I love speed. But it's not good. But anyway, the reason I'm talking is all this needs technology, and that's what is 3D is about. And it's I mean, this is they also have for anterior segment, posterior segment, and this is an amazing future microscope, Ocutrex. I don't know whether you have seen that in Europe. No, I'm asking Dakshina. No? And when you travel, you have to see here. And this guy, the developer name I forgot, you have to Google. Interesting story, Avik. The fellow who developed it, his father had a macular degeneration. So they are twin brothers, or brothers I think. They are engineers working on optics. So they have come out, they made first a low vision aid, something like eSight, and which they made for father. And they decided, why can't they extend the technology to microscope? So they come with Ocutrex. So they are calling operating room BOT 4900D, surgical visualization theatre. And it is actually a confidential information. But anyhow, they demonstrated the microscope in Frankfurt Retina meeting 4 years back. This is how the microscope looks. It's a BOT 4900 3D surgical visualization theatre. Amazing, and I think definitely better than Seeluma, but I don't know when it will come. Camtrax digital microscope, which captures live surgery feed, which is displayed to 3 visualization sources depending on a surgeon's preference. And they also have on OR lens, which is a headset. It is a headache for me. I don't like it. But it's a Dr. What's her name? My friend Anat Lowenstein is using in Tel Aviv. I one day wanted to go, but now the war has started. And they have a stereo lens with 8K and a 3D glasses-free monitor. Amazing. And the problem is we can't transmit 8K still. And I think even the movies, Apple TV may have 8K, not in other things. So this is the comparison. So now Dakshina, I have given him homework to do comparison like this for our Avik, we have to do for the 3D microscope. So you can see the optical zoom. Ocutrex has 20x and Alcon has 20, Leica 16, and in this we don't have Seeluma. So you have to add Seeluma, man. I think I sent this slide to you. And then a digital zoom is 360 times, which is not available in any microscope. I don't think it's there in Seeluma also. And micron resolution is 3.5. Amazing here. We can't. I don't know whether we can do anything in 3.5 with now, and because we are working on 30 microns. And Ankur, do you know how many microns make 1 millimeter? Dakshina? 1000 microns make 1 millimeter. And then you can see 3D everybody has. And then color spectrum is 69B, I don't know what is it. And resolution is 50, and you can see the rest are 4.2. Amazing. I mean, it's like a dream. I don't know what is happening. They have not got approval. They took my signature for becoming a whatever you call, forgot that. So I signed, I don't know what happened. So they have this headset. I mean, you can see everything inside. How long you will do this with operating like that, no? I don't know whether you have used the headset to see the, you know what is the headset for, or Bayer for the ARMD and all. You can see how it looks and all. After 2 minutes I get bored. And you cannot see the surgery like that and operate, no? The only thing you can do anywhere and do, okay. And you can see this resolution. They have 8K, and then you can see the brightness 85%, and no need for 3D glass. And you can see the Camtrax magnification. You can magnify that. This is a seed of a flower, and how the magnification, like right from 20 times to 120 to 240 times. And then this is Seeluma, which is what we are all here for, because we have it in our own backyard now. And this is took from Darshan, and you can see, and you can see it right now here with we have a video, and I hope we can make a separate video of Seeluma in the OT and put it in YouTube so that Darshan can also use it. Our what patients can see how a free patient or a charitable patient we are going to do 3D. And you can see how the surgeon can sit erect, and you see the Darshan has made a picture. If you sit like this for morning 8 to evening 4 without a backrest, the surgeon will go. So Darshan should use their marketing slides with my backrest. And then you can see the features here. And again, you see the backrest. which never touches the back of the surgeon. So we should make a movie on this and make it man. And we are 11:30 here. Where are the guests of honor and all? Nobody has come. Shubha has come. Shubha, come to the front, no? Call Anamika. No, call Anamika, no? And who else is required for and we need a stage arrangement, no? Jaideep has come. He has to give a talk here. Not come? So cancel. And so this is the Seeluma which I used to be, as Dakshina said. So all this I don't allow the engineer to talk to me. I do it in 1 minute. I can sit there with any machine and I use it. So this is advantage. But again here, practice also there is no backrest. So if you sit like this for long, you will get back pain. And that's what happened to me when I went to Kashmir and operated. I had a severe cervical spondylosis. I went and got some pain management. My anesthetist was very angry because he said the anesthetist could have punctured my lung. It was so painful, excruciating. So I just went and gave a consent and I got it done. But I'm happy. I don't have any pain. She cut off some nerve in the back, and it's okay for me. And I'm operating, I'm okay. And I suddenly remembered there's a Dr. Lakshmi she's a Tamilian, married to a Maharashtrian. She's an anesthetist. And just because she's an anesthetist, I believed her and went. But when the consent was read and my anesthetist Sharma said, "You're a fool, man. How can you go and lie down and get?" I said, "It's so painful." She gave something, I don't know what, tricot and something. She did ultrasound something and cut off that pain nerve. Absolutely no pain. Otherwise I couldn't sit, lie down. It was excruciating pain. And that is because I operated from morning 8 to night 11 in Kashmir without backrest. And this is the other one which is not available in the operation theatre called DRV. I think even Dr. Thanasis Nikolakopoulos is my friend. I hope you will see this in the YouTube now. He introduced this and it was there in Greece last week also when I went. It's amazing. This is used for watch technology or any fine machinery to check. And you keep the machine under that or a watch under that, and you can see that watch glass they use like that. This is beautifully magnifies it. This is the future of optical inspection, and that's they call it DRV, Deep Reality Viewer. Is the world's first and only digital stereo inspection system which creates full 3D HD images that appears to float in front of your eye. It's true. You sit there and it's beautiful, and you don't need any special glass or goggles, and there are no unpleasant side effects. That's correct. And you just sit back and view high definition 3D. That's my idea. Sit back and operate, which a pilot cannot do. And I loved the pilot chair. I don't know how many of you have seen in the cockpit. It's beautiful. It will go like this, and straight back like that, vertical. And I wish Dakshina. That's my dream, to get a pilot's chair for operation theatre. The pilot, not the one Dreamliner. And it is a remarkable invention which is already revolutionizing the way organizations view, capture and share 3D images of samples they are studying. They used it in the lab, but now they have brought it for wet lab. So they have the supreme comfort, they have exceptional ease of use, versatile, and again you can see nobody is using backrest. It's very bad, ergonomically not to work like that. One is exercise, go to the gym daily, do back exercise, and also do sit-ups, like what we do for Ganpati, and then come and sit, and with a backrest. And it has a long base, and has a powerful combination, real-time collaboration on a global scale, and you can see, and this is how the DRV looks. And this is Dr. On the tall guy is Indian origin from Goa, but he's the chief of vitreoretinal surgery in Moorfields Eye Hospital, De Cruz. And he's a great friend. I have invited him to Mumbai. One day he'll come and operate here. He's working on artificial retina and also gene therapy. And this is Yannick Lemaire, was the president of Gonin Club, and he was here in 2005. And we did the conference in Nehru Science Center. It is called NSS. And the short form also formed to my father, NS Sundaram. And he told that time, it is there in the recording, he said one day it will become Natarajan Science Center. I hope it will happen, because my dream is not my name. Natarajan can be my grandfather's name. idea is to teach people. Dr. Nidhi, I am going to ask question or you have to ask question. Okay? I want to know whether you are sleeping or how do I know? Give her mic, no? Dr. Nidhi. So this is how the DRB works. You can see that that's why when I posted this picture, somebody posted, see how my lumbricals and the circulation is there because I do so much of microsurgery. Shubha, you checked with the Anamika? No, she told me she'll come at 11:30. 12 to 1 we have to do online, no? அவர் இது கொண்டு வந்திருக்கீங்களா கொடுக்கறதுக்கு கொண்டு வாங்களேன் இப்போ இல்லை 12 to 1 கொடுக்குறீங்களா and so this is the one which I right now using there and so we also did a study with Dr. Aditya Kelkar comparing the 3D and conventional microscope and published. So Avik, you should go through this paper and we can again work and compare with whatever you experience next 1 week with the Seeluma, RTO, then also whoever is working on Alcon and have a comparative which is above all these companies and money and everything, which we teach the thing. So both of them have come here. Dr. Robert Redak was here in January 19th and he got the oration and he visited this place. He just fell in love. Sir, you remember meeting him. You hosted him. And because of that, this Global Fighting Blindness Foundation has come. We have still not registered. And the headquarters is Mumbai. You can see that. And actually it is Chembur on the top right. So Dr. Ashraf Armia is a great teacher in the world. He is a consultant ophthalmic surgeon in Egypt. He is a consultant cornea, refractive, cataract, glaucoma and anterior segment reconstructive surgeon. And he teaches, somehow he is so famous, I don't know anybody have heard of him. And Robert Redak runs, is the head of the Polish, is the president of Polish Association of Polish Ophthalmic Surgeon and also chief of the Lublin Institute, which is the first, one of the first trauma institutes, which is 50 years old, and probably during the communist rule in Poland. But amazing, such a big institute they have made for trauma in ophthalmology. So, you can see Dr. Ashraf Armia and Dr. Robert Redak have expanded the teachers, and it's amazing to see he is working daily. He calls me. He gives interviews in Poland, he gives in Egypt, everywhere, telling that Mumbai is headquarters. Sometimes I get jittery because they are planning so much. So yesterday, thanks to our Mr. Kumar, trustee here, he introduced me to the secretary Rajini Saini madam, and she showed me the 11th floor. And 11th floor has 5,777 square feet, amazing, available for rent, 8 lakhs a month. I hope to rent it and teach the people all over the world and also run a optometry college and institute of ophthalmology here. And this is my second mentor, Relja Jonovich. I spent a lot of time with him last month. An amazing man. And he revolutionized, to tell the fact, whatever advanced veterinary surgery is happening, he did it more than Macamar, more than Charles Keepens. But such an humble man. He didn't want anything to himself, and he said, what did I do, anything? I am not your teacher, he told me. I said, no, you are my mentor. He didn't know I have anything, so thank you for that. But right now the time is, what is the time? It's only 11, so you have time. So I can again talk something more. So why the main using the 3D, why I am enjoying is, so I am just telling about my passion on managing trauma. I told this in Shanmukhapriya last week. We had the Retina Summit of Asia Pacific Ophthalmic Trauma Society. I used to put torchlight for my father for removing corneal foreign bodies at daily 10 to 20 people. And I used to see why there so many injuries are happening. and somehow I fell in love to manage trauma. So what I did, I think I took a needle, because I used to say my father using a needle or a foreign body. In the Parsons it is there, corneal foreign body removing instrument, which I used to do, which my father used to do, and without knowing, but they used to put drops so that the patient is anesthetized and you can remove the corneal foreign body. I didn't realize that. As a 10-year-old boy, I used to make my pet dog sit, and the dog also used to show the eye, and I used to use the ophthalmoscope and see the retina with a great difficulty, and it was looking shining. I didn't know what was there, but it was a tapetoretinal reflex. Then later I started, he was using, because fundus examination was not a problem for the dog, but what I did is I opened the lid and put the needle on the cornea, and then it hit me. Luckily it didn't bite me. So anyhow, I am saying, so I was probably subconsciously learning trauma management even at the age of 10, but we all know that eye is protected. In spite of that, so much of injury is happening. So it's the number one ocular emergency, and it is the leading cause of blindness irrespective of age, sex and geographical status. Male and younger age group is greater in incidence, and efficient referral expected from professionals. So that is why we are calling this Chembur center as an ophthalmic trauma referral center. Apart from Sion Hospital, they are doing as a total body and ophthalmology. So we expect everybody in Mumbai can refer here. People who cannot afford, people who can afford can go anywhere. And every person should know about the importance of quick response to an ocular imagery, and prophylactic measures is always better than management. So 18% of posterior segment trauma consists of intraocular foreign body. I am happy Avik is experienced in managing vitreoretinal surgery for that, and retained intraocular foreign body is 5 to 40% of all penetrating eye injuries, and these are the indications for removal of intraocular foreign body. So, and then I see many times they remove the foreign body, but the problem of visual rehabilitation or visual improvement is a problem. So here we have excellent instruments for Avik to manage. So I recommend a two-step approach where you do the initial repair immediately. Whatever may be the day or night, we have to have system to repair the eye immediately and do the vitrectomy in the next 4 days. That's what he says, and I say first 100 hours. So vitrectomy should do a total vitrectomy and then do the best, all the advanced. So the main thing is it's not delaying, it's doing the second surgery. In the 4 days, you have a leaking wound is the problem. So if you are going to do the wound repair, you can do a airtight, watertight suture and do the surgery. And once upon a time, they were talking about spontaneous PVD, which happens 10 to 14 days, but you can't wait for it. Now the technologies, we have 20,000 cuts per minute, and we can do ultra-modern vitrectomy and induce PVD, and plus do the surgery. And that's what I did in Kashmir, where most of the young people, even if you wait 2 weeks, the PVD will not happen because the vitreous adherence is strong. And this is the location of foreign body, which is all based on the case basis published in journals. And the entrance site also, cornea is in the front, so 65%, sclera in the side 25%, limbus is in between 10%. So the main thing is accurate localization. So history is important, knowledge of composition and size, delineation of the extent of ocular and orbital trauma, and decision regarding removal of leaving it alone. So I also like to thank Maharashtra Ophthalmic Society, which I should have done in the beginning, which they have given this meeting under their aegis. And now I can see Elton come here. Thank you, Elton, for all your support, and Shanmukhapriya also. So I think, and these are the various magnets we can use. And I remember we used a giant magnet, which is in the history in the museum now, and there are so many. Now we have the small pencil magnet, rare earth magnets, and we need so much of instrument armamentarium. And we had a Russian faculty, Dr. Sternov, who came in 95 and gave me this forceps, which is a wide mouth, large foreign body forceps, which opens 13 millimeter. And then we also have this ureter stone forceps. I've operated in Hinduja Hospital. I also used ENT forceps. Then I made this vitreous suction forceps, And thanks to Manish Papai, Mahesh Shanmugam, we three made this claw forceps, which is a novel intraocular foreign body forceps, and we have published this in Indian Journal of Ophthalmology. So all these procedures can be done at Chembur, and which is a, and then we can also use the perfluorocarbon liquid, which was developed by Stanley Chang, and we have all that, no, PFCL oil, and we also and then everything I have left to Avik, so he has kept everything ready. So these are the now you can see this is the video which has been done in Kashmir, where we have done the vitrectomy for intraocular pellet removal, and you can see the wound, the front of the eye was sutured, and there's a special incision I made in the 11:1 and made this four-pronged forceps. I use this forceps when the pellet is within the vitreous hemorrhage, and that's my technique which I used, and you can see I can remove it through the separate wound, close that wound, and then continue the vitrectomy. So this is a pellet. So 1,000 people had pellet injuries in Kashmir out of 10,000 injury which happened, but every patient, it's a back-breaking surgery. I did 47 surgeries in 2.5 days. Similar thing we can do here, not in a catastrophe like that, but I think we can do one day maximum number of surgeries. That means we have 2 operation theaters here. You can see the pellet had hit and gone through and through next to the optic nerve, and sometimes it can hit and produce a hemorrhage. So the advanced vitreous surgery can give vision to badly injured eyes and make the patient see. And that's where our Blind Free India comes. And one is to prevent injury, and if injury happens, we can do advanced surgery like this. And this is the retinal brush. I'm doing endo drainage. That means removing the fluid and injecting the air simultaneously. And this is another patient with a silicone oil where the retina is attached. And then we also have this is a 25-year-old gentleman with a firecracker injury. So KamalaSundaramFoundation, as I said, supporting the Ocular Trauma Society of India. And Elton, we have made a KamalaSundaramFoundation as funded Ocular Trauma Society of India. We have employed visually handicapped, or not handicapped, what is the word? Visually? Huh? Yeah, visually impaired advocate Rahul Bajaj as representing us. Finally, the PIL is taken in Delhi High Court. Hope to get a ruling to prevent this cracker injuries in children at least. We are not interested in banning because it's beginning. When we use the word banning, people are mistaking us. And I'm talking in a public forum, and this is in the court. Now we are telling to regulate the cracker sale in India, where the Netherlands government, my friend Dr. Dijerd, has got it fighting with the government and the public. He got totally banned in Netherlands. Singapore is banned on their own. China makes the crackers and sends to all over, and it's banned in China. So this patient had, you can see the devastating injury happened because of the cracker. The total eye was become blind, and I'm doing this vitrectomy, and you can see it, the vitreous is charred and looking yellowish, and which is supposed to be transparent. That's how the patients can see. And the vitreous is the glassy material in the back of the eye, where we have in the camera where we have a space between lens and the film. The same is the vitreous, and that's now filled with blood. So we are removing the blood, and there are particles which has gone because of the cracker. When it explodes, they sometimes keep it in the coconut shell or in the bottle or whatever. So the problem is many things are small particles get into the eye or face, and unnecessarily people go blind. And they use rocket. There was a guy, they used it in the wedding engagement or the day before, and you can see there is a small foreign body within the vitreous hemorrhage, and now I am grasping it with the forceps which you have designed, grasping it and removing it. So any of these injuries can produce devastating to the eye, which I think we are experienced to repair, and that's what Kamala Sundaram Eye Center will do with Dr. Avik. But why can't we prevent it? And I think we should have some preventive pamphlets or e-brochures to give it to the patient. And you can see the pellet, maybe there are 2-3 foreign bodies, and we are again grasping from one more and removing it. So you can see this is within vitreous hemorrhage, which is grasped, and now we are removing it through the incision which I made. So this is a fine, intricate surgery we are all trained to do, and Avik showed his video in the morning, and it was excellent. He has excellent hands, and I am happy he does better vitreous surgery than me. So that's important for the poor patients and the patients who are going to pay less, but they will get the best care here because we got technology, we got experienced surgeon, we got good staff who will assisted him, and we have Joyce who is there with us for more than 39 years, who is like a mother supporting us, and Mahadev who's come from, who was with me for 35 years to do all this for the poor people. So this is, I think, took 3 hours surgery to repair the eye, and we get vision. I mean, again, patients in Aditya Jyot, we have a program when a patient like this has no vision in that eye, and we operate, and when we get vision, 6 weeks later, we celebrate the vision. The meaning is, we celebrate the patient has got vision. We thank the God for with the gratitude that he got vision. So we buy cake, cut the cake, and if the patient is diabetic, we don't allow him to eat. He cuts the cake and gives to all the people, and then we also thank God. And then if he likes, he gives an interview, and that's called Happy Smile. So we should start that here, Avik. Your patients, even cataract. Today we are operating, he is almost having a cataract and blind in one eye. He's a diabetic, he is not done. So I am happy this video I got today. This video I was searching some time back. Oh, what happened? So this is a glass foreign body. Video is not playing here. Samir, the video is playing here, but it's not working there. Why? नहीं इधर काम कर रहा है. समीर किधर है? समीर, प्ले वीडियो इधर. नहीं, video is not playing. Why? This is a foreign body video I was searching. Today I got it. बाद में चेक करेगा. ठीक है. So we'll edit and put it in the YouTube later. So this is what I operated in 1991. You can see people appreciate that I got videos from 91. Actually I got from 84 also. I don't know where are they. And because of that only I got the prize in 1988 for the best video in All India Ophthalmology Conference, and that's how I came to Mumbai. So you can see this is my voice in 91, but anyhow I am cutting short. You can see the emblem, which was a round one, which is exactly similar to Shanmukhapriya. Dr. Badrinath used to scold me, and anyhow then Allah blessed me. So there was a foreign body in the cornea which I removed. Now actually I am removing using I couldn't afford diamond night 91, so I used the blade, and I am dissecting that. This was a simple bow and arrow injury. When that time the bow and arrow Ramayana was going on, so everybody was playing bow and arrow with a broomstick, and this was that broomstick injury which came from Pune. I remember almost a few days later. You can see that part of the broomstick which is there in the blade. I removed it and then produced an inoculum of infection into the eye, and now I am using a 20 gauge. That's what we were all trained. And we have also done vitrectomy with the indirect ophthalmoscope, which Dr. Namparamal started, Dr. Nakpal, Dr. Badrinath and myself. They are elder to me. They are all 80s, 85. And anyhow, I have done, even at the age of 27, maximum number of vitreoretinal surgery, and I was a young vitreoretinal surgeon that time with experience. How old are you, Avik? 30? 33, good. So anyhow, 27 I was on faculty with Dr. Badrinath, and I used to be equal with Dr. Namparamal and Dr. Nakpal, and Dr. Jovanovich recognized that in 1986 and told he looks like a resident but he knows more than all of us. thanks to his blessing. I'm not telling all this for my boasting, but I want people to know, young people like Dr. Nidhi, she can become an expert one day. Not today, but one day. So I didn't have any inhibition because Dr. Badrinath took care of me like anything. So this man had an injury with a thorn, which happened in near Sangli. He fell down while he was cutting the thorn thing for a fencing, and he didn't even realize the thorn went in. He just rubbed it off his eye and went away. And next day the eye was red. He was putting some drops on his wound, buying antibiotic from the pharmacy. And 2 weeks later he went to the doctor. Luckily he didn't develop endophthalmitis, but he developed uveitis. And everybody was treating him some redness and uveitis. And this was the entry wound of the thorn. And I tried dissecting, and I didn't know. I didn't know because of what was there. And I didn't know whether I'll find a foreign body, but I was exploring. You can see severely inflamed eye, steamy looking anterior chamber. I cleared. There were exudates in the anterior chamber. I used horizontal or vertical scissors to clear it. You can see hypopyon. Now I have done a lensectomy, vitrectomy, and I cleared the debris in the midvitreous cavity. This was in 93 with a video. I'm happy. Like this, we have to get old videos and put it here. So now you'll be seeing this. You can see that was only I don't know how many cuts were there in 93. 800. You can see that so slow it is, and I cannot believe that we were doing this. And anyway, that's how the surgery develops. So slowly, now it looks like now you can see the thick hypopyon, which I am removing using a needle. And I have the habit of sending everything to Dr. Bishwas that time into Shankar Netralaya, and he will do a study and give a report sincerely. And he was charging only 200-300 rupees for that. And this is a vertical scissors which I talked. The exudative material was there on the surface of the eye. This I called anterior chamber cleaning. So I am like a street sweeper, where you have to clean everything, the eye. And this is cleaning the eye surface of the iris. And you have to be everything needs. But Dr. Badrinath taught me your hands should be like Bharatanatyam dancer hands under the microscope, and not like a devil. So that means it should be so fine, and then whatever you do should not injure the iris, and underlying, or you are producing a dialysis, then you make the complication more, bleeding more, and you can even lose the eye. So that's where your expertise, the steadiness comes. So I think yesterday Tia was in the OT and was talking about tremors and how your hands are steady. And I think thank all my 3 generations, God, for that steady hands, because without steady hands you cannot do that. And I'm happy even today I have it. I hope till the time it is there I will operate. After that Avik will take over. So it's taking time. I say the time is 11:20. So I'm engaging the people who are watching. YouTube people are watching. You can see now I'm using the cotton tip applicator and depressing and cleaning the pars plana. Avik, can you guess what is there? I'm depressing the pars plana and cleaning. I thought that time I'm only doing the exudates on the periphery, in the pars plana region. And slowly I see something brownish, then I thought it is choroid. I was thinking, so I was slowly touching and seeing what it is. Finally it was thorn. And the thorn is, you will see, it is 13 millimeter and totally merged with the, camouflaged with the exudates, choroid and the back of the iris. And in ultrasound, we didn't have a good ultrasound that time. And Dr. Deepak Bhatt used to come and do ultrasound and then learn inside the OT how to interpret. So he had a first-hand knowledge of him. So you can slowly see that is the thorn. So when I identified it as a foreign body, then I went to the posterior pole, cleared everything. And you can see that this was a BIOM, but the problem is the light pipe was only 30 degree. And when the BIOM introduced, Dr. Spitzners was ahead of time. And the light people did not make a 60-degree and wide angle light. I mean, all sorts of problem. And so when you illuminate only one part, you will see. So you can see now I am clearing the debris, and now I am using the Macamar forceps. So I am holding the Macamar forceps and then illuminating. You can see the thorn now. It's a 13 millimeter thorn. So when you remove, if you don't catch carefully, two ends will damage the retina. So you have to really have the three-dimensional view in your mind and imagine where you are holding. So I was holding like this. Every time I was careful. This I think I am holding in the left hand. Then I now will make a corneal incision. So this now I am thinking what I am going to do. And this is a 20 gauge infusion line. And then I knew that I cannot remove it through pars plana. So I will use viscoelastic. That time we had methyl cellulose to inject the endothelium. So again I have only the blade. So Dakshinamurthy, Vallavanukku Pullum Ayudam. You can translate. Shubha and Avik don't know. So if you are an expert, even a grass can be used as an instrument. So you can see now I am making a corneal incision. Then now I am injecting methyl cellulose in the AC to coat the endothelium and make sure you catch the tip. And you have to do acrobatics within the eye. And that's what I live inside the vitreous all the time. So you can see the 13 millimeter thorn. Na Shubha? Shubha, see the thorn. 13 millimeter thorn from inside the eye. I welcome Veda madam. You can come to the front or sit with the Shubha. Shubha will teach you what is the operation going on. Dakshina, Dakshina, meet Veda madam. She is our new volunteer. So now I did a cryo. I don't know why. But there was no break, but I did it. I did a belt buckle. And Dr. Jovanovich used to do a silicone rod. And you can see lot of exudative material removed. So I am actually seeing this video after so many. This is another patient where you can see another wooden piece covered by exudate, which was a irregular rectangular shape, but not so big, but it was again playing with some wooden thing. The wooden chip went into the eye. So never give up, and that's what Dr. Gopal was talking last week in Shankar Netralaya. Every wooden injury will not produce fungal injury, a fungal infection. So it can be luckily. So you can see this wooden. Avik, you saw the wooden one? See, you can see this wooden piece. So I think maybe I have done the maximum number of trauma patients in the world, because I think right from 84 I am doing. And even now I like to do. See, this is such a big, I removed through pars plana. And this is a double perforation, foreign body beyond the orbit. So I don't know what I am doing now. I forgot. I used some needle. And this is another eye. So Dr. Nidhi, you want to ask any question? Why? Avik, you want to ask any question? Or you want to talk? Any question? Already Amara Vaishali madam is yawning.
Sir, anything like your seeing your videos, those are definitely wonderful videos. Any particular thing you do for metallic and non-metallic to separate? Like for non-metallic foreign bodies, do you do any other maneuver other for for the
non-metallic? This one I use a handshake technique and use to instrument forceps to grasp it and remove it. And metallic you can use the foreign body. So I actually didn't publish. I introduced the handshake technique hold the foreign body in the long axis and use the other hand to exchange, grasp and remove it, because removing the foreign body is the problem. But now you will see this one I am doing another technique where it is near in the pars plana region, clean 6/6 eye with a clear lens. So I actually use this rare earth magnet made by an Indian one, and you can see I will remove it from the sclera wound only. So this is a magnetic one, and usually I don't like to remove from the same wound. Yeah. But here pars plana also was a problem, and neither it was inside, but it was intrascleral. Okay. And there was a vitreous loss. Then obviously that means from pars plana also the injury has. So I did a wound toileting without going in using the vitreous cutter. So the idea was to do the wound toileting so that the water flows out, and I am using the infusion line using 23 infusion. If you see, I have only 2 ports. So now I am using the magnet, and because I don't know where was the foreign body. I didn't have endoscope that time. Then after that I bought endoscope. See, now I am trying to meddle with through the same wound, which generally I don't do. So metallic I use if it is a magnetizable, that's why I have a presentation metallic, magnetizable, non-magnetizable, and that's how I have all sorts of forceps with me. And now I saw a beautiful forceps designed by Arvind Hospital, Madurai. I forgot the name. It's called, it is like that, so this is a foreign body, you can see. Yes. So, and the patient maintained 6/6. Amazing. And I don't know where was the foreign body. It was probably anterior to the lens and somewhere in the pars plana. So this was iron piece. You know this rare earth magnet, who makes it? You should buy here. You should buy. It's not expensive.
I have to check, sir, because in Arvind also used to use a very old one.
No, we made a list because I used to, because I had a tough time starting a vitreoretinal surgery in 90, because nobody was doing in private. So Dr. Nagpal was doing, but he also was doing the, so I just injected air in the conclusion. So I made a list of instruments which company makes and who supplies, and then I gave it to every participant from 91 every year. We had Sister Elsie who made it, and now I think we should make it. Joseph should know, because we have bought from various companies. You can help anybody, there is no competition.
Sure, sir.
So the prognosis is different, and as I said, we are doing this training here, and which will be done in this center. And Joseph, where is Joseph? But we need Shubha, we need this thing for make a stage arrangement, no, where will the chief guest and trustee has to sit, 3 of us. No, we have to put that, he knows, I think. Can you call Joseph Vishwas? So this is the other one which I am happy Dr. Avik is specialized in this, refined reconstruction of traumatized eye with no portion of light and restoring best vision. We talked about all these injuries. So this is what we have to do: strategic thinking, systematic approach, and then we have to decide when to do. And this is a 76-year-old male who had he was the principal secretary's father from Maharashtra government. So this is how the eye represented. So the injury was in Lucknow. The next day he came. I think that was a mistake of doing a belt buckle, and I injected a viscoelastic, and also eye was fully full of blood, front and back. So I did this belt loop, and I did all around the eye. So everything I do under 3D, and you can see I am doing the 23 gauge. So you will see this actually, in spite of all the experience, there will be a bulge happening now, and I thought it is a wrongly placed infusion line. So by the time I realized it was a expulsive hemorrhage, and I didn't realize it. I was proceeding and I was doing something. I was not nervous, but I didn't know what was happening. But I injected a heavy oil, I injected air. When I realized it is this, expulsive hemorrhage, and I did remove the band because no use that time, and then closed the wound. And then 2 weeks later, I did the surgery, and this was the eye like that. And then I did a vitreous lavage. Because expulsive hemorrhage, everything was expanding, the retina tore, and there was a large retinal tear in the temporal side, and also macular hole. Now we need a stage arrangement. No? We can do it now. Start doing it. Thank you. So you can see the large tear and a subretinal oil. So I went inside behind the room and removed the oil. So Dr. Nidhi, have you seen surgeries like this? So you should come and be observer. So macular hole I don't generally do, but I did an endodrainage because I knew that if I use PF seal it's a problem. And then this was the eye at the end of 2 weeks, and then we did that. So this is a pellet injury which was done in Kashmir, thanks to एक टेबल रखने का ना, or you can keep this table you can keep, no problem, enough. No, just to keep some water, and that's okay, you do it later. No problem, no, that's okay, na? Camera is here. Anyway, we are going to edit it. So this is how the wound looks, and this is the previous patient's macular hole. Also I did laser, and patient got 3-meter vision. And this is a 63-year-old grandmother playing with a grandchild. Her leg slipped and fell, and she got injured with grandfather. This grandmother played with the grandchild, and then when she played, the grandchild was slipping something. She got injured with the tip of the table, and then lost the eye. And then I did this surgery. So you can see she came with multiple hemorrhages all over, and then almost I think 4 or 5 surgeries I have done. Your torch is on. Your torch is on. Unga torch on. Illa, unga light la. Sir, meet your meet our trustee. So this patient, this old lady had a injury, and then now I am removing the scar tissue because multiple operations done, bleeding happened, and the whole idea is to remove the membrane, and you see that was the membrane and retina is totally attached. So the philosophy is to repair. However, the chance is only 1%, still we will do surgery. Joseph, I need Elton here. Joseph, Elton. So we have started this KamalaSundaram Eye Center at Shanmukhapriya. Thanks to Shanmukhapriya for this is my idea, philosophy. Now I am living with this idea, Blind Free India. My vision for screening to surgery for proliferative diabetic retinopathy. And I am happy Shanmukhapriya bought this idea of running eye center, but only Elton has taken my idea totally, and no other friend. Thanks to Ravi, I showed Ravi's photo also, but Elton is the only one, and followed by Shubha. So diabetic retinopathy is the major cause of blindness in the working middle age problem, not only in India, globally. And the eye is also called the globe. So Elton, this is what we want to prevent sitting in Shanmukhapriya Center as one. Diabetes can affect eye, produce all this problem and blindness. It affects the brain and produces a transient ischemic attack, stroke and cognitive impairment. And then it affects the next is the heart and produces high blood pressure, coronary heart disease, angina, heart attack. My driver is admitted in Kikabai today. And kidney, we have dialysis here. So, and neuropathy, we have my friend, I saved his eyes, but now having neuropathy problem. And extremities, we have peripheral vascular disease. So, all this can be prevented, and money of the people, money of the government, and whatever we are getting donation can be used for something different by teaching in the 11th floor. So, that's why I want you for the presentation. So, diabetes can lead to severe damage, and many people are like United Kingdom realized it long back. So, they have a Queen Elizabeth medal. If a diabetic patient lives 25 years with diabetes with no complication, they get a medal. If they live with no complication for 50 years, they get another medal and more money, some pounds. And I think we should start some scheme like that. We don't know how to do it, but we have to do. And this is the publication which is in Lancet, which has the high impact journal, published from Chennai by my senior Dr. Mohan Vishwanathan and Dr. Ranjita, daughter. 101 million people are living in India with diabetes. 11.4 people of India, 11.4% of 1.45 billion people in India are having diabetes. And government of India is saying 136 million people are living with pre-diabetes. That means they can get, and then 15.3% of again 1.45 billion people are having. So somebody who is good with numbers should work on it and work on health Ophthalmology. So what is diabetic retinopathy? This is for you, sir, trustee of Shanmukhapriya. Diabetes is a serious eye disease. Retinopathy is serious that can cause vision loss and blindness with people. And he will tell you more. What, sir? Subramaniam, sir. You will tell, no? And the temple is in your name. And it occurs when high blood sugar level damage the retina. And I want to tell you the diabetes sugar in your mouth affects every cell in the body. And another thing is true, whatever you think, every cell will listen to you. So that's why I don't wear glasses. My eye listen to me, I don't wear glasses. And complications like this happens. And all this we need ultra-modern instruments where we got 5 crore from Sahachari Foundation, GBK Foundation, ACG Foundation, Elton, and then thanks to our, what is the foundation helped us? No, trust. No, that I have told. Your friend, Nipa Sheth and Trust Group, and then yesterday, Kotari. So thanks to all of them and everybody, Mr. Elton is taking, and I told Avik and Joseph that you tell us what you want to prevent blindness. We are here to collect the money. And it's not only Elton, me and Ravi also. So we spend money on doing this test, fundus fluorescent angiography, then ocular coherent tomography, which I introduced first in India, ocular coherent tomography, angiography, and they call the short form of Octa. Hello. And we have Dr. Rahul, our anesthetist. Thanks for coming, sir. Today, are you the anesthetist or a guest? You are a guest. Thank you. Huh? I know. And B scan. So we need money for, I think, no, we are getting it from other, we have to write down a grant. So all this needs money, and we need a laser, which we have, and we do pan-retinal photocoagulation. We need money for injecting the eye, and then we need surgery, which is what, like this, if you don't treat, your eye gets membranes like this, and they go blind. And if you don't, and then this is what I do, and now Avik is doing. He did already last week, and today we are going to do together. This is the sutureless surgery, eye surgery, which we introduced first in India. My friends introduced Mark Humayun in the world in 2004, and Mark Humayun was here, and he also he got the IPR for artificial retina. So we have to do this advanced surgery. Again, it takes hours to do, remove this membrane, and membrane is like a thick sheet on the surface of retina, and when you pull, it can tear, and if you tear, the eye is gone. So that's where the delicate surgery is. It is like silk cloth on a thorn, and if you pull a silk cloth and the thorn, nothing will happen. Thorn will tear the silk cloth. So that's where our surgeries are, and you have to do meticulous surgery like this, and then finally clean the eye like that, and the retina looks so beautiful. And this is what it took hours for me, and the patient got vision. And this is what we have the various microscopes we talked about in the beginning, 3D surgery. So diabetes is an epidemic happening, and every diabetes will be affected with something. And that is where our dream, which Vishwas is working on the concept and publishing, from the age of 35, every diabetic should do HbA1c. Thank you, madam. Padma Ramurthy has come, and Padma is a great Bharatanatyam dancer. So she is going to perform today. Madam, you are going to perform now. I told about you before you came. Dr. Badrinath told me the surgeon's hand, that is retina surgeon's hand, like me, he will tell me, hit it with the microscope. Don't come like a devil. Come under the microscope like a Bharatanatyam dancer's hand, because the hands speak. Same thing we deliver in the eye. Yes, this means eye. And he told me that. And every day we used to play MS Subbalakshmi, Korai Ondrumillai Kanna, in the morning and operate. Start at 8 o'clock and go until 1 o'clock. So eye symptoms are late. That is why our social workers are here. They have touched 300,000, 3 lakh houses and 12 million people in slums of Mumbai, not only Dharavi, Govandi, Dahisar, everywhere. And we have 2 vans, thanks to, where is Mr. Kumar, sir? He is going to arrange, and where Ranjana madam also is going to come and help us, give us the place. So we have to do prevention, and that is what prevention is better than cure, which we learned in medical college, which is there in the subject for last 75 years in the medical curriculum, but we don't prevent. And all subspecialties have come, like a surgeon like me only doing retina, somebody is doing only cataract, somebody is doing glaucoma. So I mean, it's a day of specialization, but if we prevent, nobody will have work, but that doesn't happen. 1988, the Moorfields team came to Bombay and told me, Dr. Natarajan will put you out of work by doing laser to every diabetic. Nothing happened. Even today we are operating. In spite of I am telling, we will have problem, but we can reduce the burden so much so that people will live happily. So we need endocrinologist, we need dietitian, we have Hema madam here, we need ophthalmologist, we need social workers, we need women volunteers like Veda madam and Padma madam and Shubha madam, and then they have to learn from Meenakshi Tapeta. So this is the one which I did as a president of All India Ophthalmic Society, screening through teleophthalmology to prevent diabetic blindness, the acronym called Stop Blindness. So I am happy Elton is working on it. So the idea is to do screen, diagnose and treat. And I don't know whether any of you have worked in cancer. In cancer, Government of India has made a law. If you screen, do a camp, screen whether it's cervical cancer, breast cancer, a lot of camps happening. And if you screen and find some cancer, and if you don't treat, you under IPC, you can be arrested, you can be punished. And so that is what is not there in diabetes, unfortunately. But anyhow, Shivanandan, my best friend, says there is law. If you do a murder, I forgot IPC what, for murder is hanged to death. He says, how many are hanged? Welcome Anamika madam, please come. Shubha, welcome Anamika and come here. Nidhi, you can come here. No, inga ukarunga madam, Padma, ninga minute ukarunga. Hello, ukarunga madam. And Anamika, you have to meet the Bharatanatyam dancer. And Shubha, come. Come to the front. So, can you give some coffee to the chief guest? And also to Padma and everybody. Srushti, can you get people to get whatever coffee, snacks you have, no? Give. Yeah. So anyhow, this is the idea. Sorry. So, Elton, that is why Meenakshi and team are doing this. Every day they are doing pre-camp awareness. Assembling diabetes is a challenge in anywhere in India. They don't want to come because they think I have to go for work. I don't have time. I will not give blood. I have eaten now. We can't do fasting, but they are doing it daily. Then we can capture images. We can train anybody. So I call it ABCD. Then we can. This is what I want to do for nationwide screening. And the problem is we only have one ophthalmologist per 100,000, and 70% of India live in rural area and urban slums. That's why we need teleophthalmology, and that's the great contribution, no financial interest. And then we want to use the offline AI, and this is so simple, Elton. You should also learn to use it because you will pick up in 2 minutes. This is a mobile phone. and that's how the photo is taken by that any boy. Nobody know English. Oriya boy or a UP boy can do it. Instead of, I want to tell the UP Chief Minister, instead of having that Romeo police, train them for doing this. So this is how the AI can be applied, and then they can diagnose. So no need for any technician, even Vaishali can do. So this is how the photographs are taken. And this is in comparison with the 50 lakh camera we have. We have published in JAMA, and this was the best term. So thanks to my friend Dr. Kalam. He has come and met, I think, Meenakshi, are you there in this photo? He has come and met every staff of Aditya Jyot Eye Hospital, Aditya Jyot Foundation, because he gave the name in 2005 as the President of India. You can see he was standing and giving a talk, and I was sitting. And the ADC was getting angry, but anyhow, he was such a kind man. He says, no protocol, no problem. And then this is my father and mother. The center is named after them. These are our trustees. And then we do with BMC daily. And you can see our Vaishali, even under the tree they sit and do. And I salute them. And when I tell this, I am really in tears because I am in tears with joy. And I'm emotional. Thank you, Meenakshi and friends. So I follow Swami Vivekananda. So he says, they alone live who live for others. And Tirukural number is 224. Settarukul Vaikapudam. That means they alone live who live for others. Rest are equivalent to death. Thank you.